Whether you're a solo provider or in a group practice, Therapy Notes not only helps you grow your practice, but grows with you along your journey. With live customer support 24 hours a day, 7 days a week, and an extensive feature library, it's no wonder Therapy Notes is the #1 EHR trusted among mental health professionals. Try them for free for 2 months using promo code MODERN today.
Therapists, do you know if your clients are getting successfully reimbursed with the super bills you give them? Insurance can be confusing to navigate, leading clients to quit therapy early. Join hundreds of therapists who use Thrizer as their go-to resource for successful out-of-network reimbursements, helping them get and keep clients in their practice. Visit join.thrizer.com/modern therapist to learn more and get started.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhelm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhelm with Katie Vernoy, and this is the podcast for therapists about the things that go on in our field, the things that happens around mental health. This one is potentially a little bit more public-facing podcast because now that 988 has been out for a couple of years, and we have done a previous episode right around the launch time when 988 rolled out nationally. We will include a link to that in the show notes. We had outlined a couple of years ago some concerns that were going to be there, and we were right. And
why did we have to be right? Oh, it's so sad.
So a little bit of background. 988 is the national 3-digit telephone number for people who are experiencing mental health crises, and was a very intelligent, let's take the National Suicide Prevention hotline number that was 10 digits long. Let's put it down to 3 digits. Let's make it readily available. And it is now part of the standard of practice for many therapists who are working with suicidal clients to have this be part of a safety plan. And in this episode, we are going to talk about what is going well with 988, what is still correct after 2 years of the sky is falling from 2 award-winning podcasters. And this starts with I guess just a little bit of background. If you look at the numbers behind SAMHSA, behind 988, they are saying that 98% of their calls received or their texts through their various platforms are being successfully handled.
So that's a positive.
That is a positive.
Before we go too far, I do understand that the Canadian line is also 988. So we're really limiting this to the United States 988.
Our interest in this was renewed when Katie sent me an article from Mad in America by Rob Wypond. This is from June 8th, 2024. And the article is titled, quote, "Confidential," end quote, 988 conversation records shared with corporations.
Oh.
Interested us in like what's really going on with 988. And Rob Wypond has done most of the research for us. So we're going to reference a couple of articles that Rob has done, as well as some of our other research. You'll find all of our show notes over at mtsgpodcast.com. But it's very, very, I don't know, 21st century with where the hell isn't our data being sold, and especially with such sensitive areas around mental health crises, and just damn it.
Yeah. Well, I think digging into it, there's the potential that some of this call is being recorded for research and evaluation and customer service monitoring, whatever, blah, 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 that is giving folks permission to potentially sell data. I don't know did you read that they were selling data? I know that they're certainly taking research proposals for pretty intense data that's gathered. But I was just concerned because I don't think people really understand how much data is gathered. So in looking at it, I saw, and I'll link to a lot of stuff. I went down a rabbit hole. So I'll link to a whole bunch of stuff in the show notes over at mtsgpodcast.com. But I think there's, I don't know, research grants that can look at, suicidality, and, you can get some anonymized, de-identified data around demographics, around what interventions were used, that kind of stuff. I saw something where there's, a higher level request to get really, kind of restricted data. And so my assumption is this is data that people are not necessarily realizing that's being shared because it's, I'm assuming, a little bit more intense in how much is shared. They talked about transcripts and recordings being shared. And some of this is for research, and there was, well, there we can talk about that if it makes sense. But to me, the concern is in the article from Mad in America, there was an implication that the corporations were using this for AI. And and whatever, AI is coming. We've got a lot of episodes on AI. We'll share that in the show notes as well. But I think if people are not aware that this quote unquote confidential line is being used in this way and that their data is being shared, even anonymized, the concern that the Mad in America author put forth was, if you're talking about suicidality or mental health concerns, you're going to talk about people and places, and you're going to provide your own identifying information that theoretically could hit a little closer to home than you expect. So to me, I feel like it's the lack of transparency and the use of data from folks who are at a most vulnerable state that really is bothering me about this. I think that the research may be great, the use of AI to try to help because, crisis counselors, all people are have a really hard time predicting if someone will complete suicide. So maybe there's some beneficial things happening here, but I feel like the callers aren't really aware of what they're signing up for. And that's separate from they're going to find you if they're worried about you, and that's another issue. But you call in anonymously, that doesn't mean that they don't necessarily know your IP or your geolocation. So
There's so many things that we uncovered in this that I don't know that we're going to do any of these areas particular justice in this episode, and maybe we're going to end up having some follow-up episodes on this. But
and if anybody wants to call and talk to us about this, we would love to do some interviews on this. We wanted to get this information out, and so we're going based on some concerns. But yeah, I could see a series on this where we actually talk to folks. If you're a 988 crisis worker and hotline worker and want to talk to us, or someone that's working behind the scenes, or have a program, or you've called and you want to have us share your story. I think that there's more that we can talk about here. So I'm fully aware that this is just touching the surface and starting the inquiry here.
as a skeptic, as somebody who, pokes and prods around a lot of things, but also as somebody who's very much based in laws and ethics, I don't have problems with the sale of, or even the giving away of aggregated anonymized data. That would be things like number of calls, demographic information in broad swaths, even down to areas like by zip code that is generally uncontroversial and is even allowed within things like HIPAA as far as data being able to be given out to places. I don't have any problems with that kind of stuff. Further, I wouldn't have problems with the content of calls being coded into certain ways. We've received X number of calls about direct threats, or in the moment kinds of, I have a weapon, I am in the middle of, this is my very last call unless, you're able to talk me out of this. If those kinds of calls are codified and being given to researchers, I wouldn't have problems with that. Where this article by Rob Wypond points out is that there's not much transparency from either SAMHSA, who's the federal oversight of 988, or a company called Vibrant Emotional Health, which is the administrator of the 988 system. This is a nonprofit organization that runs the 988 program and amongst some other things. But when we're talking about confidentiality, just about every 988 website that I've come across, whether it's the national one, whether it's down to the local administrators out of it. There's a couple here in the Los Angeles area that route all of the Los Angeles area code phone calls to them. We'll come back to that point in just a little bit. But every single one of these websites say, when you reach out to us, this is confidential.
Yeah.
And part of the lack of transparency problems in that is, for us as mental health professionals, confidentiality has a very strong and big meaning to it, which is, by law, what we talk about does not warrant us sharing this information to anybody else unless there is specific exemptions to these laws. But there is no informed consent that comes into when somebody calls into 988 that explicitly says, here is some of the reasons that we may share this information. And I think that this is some of the transparency problems that end up happening, is when you and I say, hey, I'm not available 24 hours per day. If you are in a crisis and you need to get a hold of somebody, 988 is a resource. It's confidential. It's not the same kind of confidential that you and I have, because the people who are staffing the lines are not mental health professionals. What 988 is not providing therapy, which is where confidentiality, amongst other healthcare services, but they're kind of skirting this line where they're not saying, yeah, we are covered entities under HIPAA or anything like that. And so there's some subtle legalese in this where it's like, yeah, it's confidential, but they're not bound to confidentiality in the same way that mental health professionals are.
Therapy Notes combines billing, scheduling, and notes into one easy-to-use streamlined software. Plus, they now also offer group telehealth and secure messaging features. No matter where your practice takes you, you'll have all the tools for success at your fingertips with Therapy Notes, giving you time to care more and worry less.
Learn more at therapynotes.com and use promo code MODERN for 2 months free.
To make sure we get to the other points, I think just to wrap that point up is, to me, there is probably some more digging to do and more understanding to do around what is this data being used for? How aware are callers that their actual voices or the transcripts of their calls might be used for research purposes? And I think for therapists to understand, like, you're not sending someone to another mental health provider, you're sending someone to a crisis line that we'll go into at this point has some different infrastructure problems that may or may not be helpful to your client. So confidentiality, anonymity, those types of things cannot be guaranteed for callers. And part of it is, if someone is an imminent risk for suicide, we do have the ability to break confidentiality. I think that's one way they're skirting around it. But the other thing is that, yes, they're taking great pains to not be HIPAA compliant and not, follow those rules. They're not a mental health provider. But the other thing too, and this was the other article on Mad in America, was that you could call, and if you're talking about big emotions, those types of things, they're going to go to, are you going to, quote unquote, commit suicide? Are you going to kill yourself? Whatever those things are. And if you are, I don't know, but from the stories that were discussed in this article, if you are not able to say definitively, no, I'm not going to kill myself, or if you don't answer completely, or those types of things, they can figure out where you are. And whether it's from your IP address or your geolocation, those types of things, like, they have resources to find you. And so you're not anonymous. They can actually find you and involuntarily commit you, or try to convince you to voluntarily go to a hospital. And so what is very concerning is that the whole point of 988, and I'm moving on to a different issue, so hopefully this is a decent enough transition that our listeners will follow. But the point of 988 was to try to become more informed and have mental health supports. And instead, what has happened is an increase in involuntary hospitalizations and an increase of police calls, because there's not infrastructure. And that's actually, if, I'm back, I've got the old episode up, and our first concern was a lack of infrastructure and a lack of local resources to handle crisis response. So this has just blown that open, where police are called more often. crisis response teams are not as available, although they can be called, and that is a positive if it's more going to these crisis response teams that are mental health providers. But people are being coerced into voluntarily hospitalizing themselves or being picked up and involuntarily hospitalized. And so hospitalizations have gone up, as have calls to the police. And so there's been kind of a combination of, yes, people aren't calling 911, but 988 hotline workers sometimes are, and it is increasing the things that we were worried about it increasing.
One of the other problems that we came across while researching through this is kind of an unintended consequence of the 988 system. And this is the point that I said that we would come back to earlier, is that people who call into 988 are not routed into the nearest 988 center. They are routed to the 988 center that is in the closest proximity to where their phone's area code belongs to. And in trying to deal with the various mental health systems across the country, this creates problems for places that if somebody is traveling from Los Angeles to Arkansas and ends up calling 988 in Arkansas, whoever is staffing the call center in Los Angeles may not know what the resources are or the interventions are available in the geolocation where the person actually may need services, which, with the amount of training by the callers, would probably often result in routing those calls to a local 911 area, which does have the geolocation available.
Yeah.
One of the unintended consequences is that by routing phone calls to the area code call centers, is that particularly in high population areas, this has led to an under advertising about the 988 system in general, because call centers with high populations are going to now have to be responsible for large populations of people who travel all over the place. Now, in the brilliance of fixing one problem and compounding another, there's currently a bill going through the US Senate in order to address this very specific problem. And this bill would address the 988 problems by moving it over to the same system that the 911 system uses, which is further geolocation of callers and being able to have it specifically identify the place where the caller is calling in and routing them to a local call center rather than to the call center where the person's area code is from.
So I could see that being very helpful. You're concerned about this bill?
I'm concerned that when we're talking about the confidentiality and the data leakage that goes along with this, that what is being sold to the public is this is anonymous. You can call in. We've got our protocols, is that this is further data collection, and the ways that places, the call centers, the Vibrant Emotional Health, VEH, the oversight company, what they're doing with the data, and things like their websites that have trackers that sell information to Facebook, as pointed out in the Mad in America article. If all of this data is not only not being aggregated and anonymized, that we have problems in the way that we're managing the data, should we be giving more specific data to these places?
I hear you. And I think that there is probably some benefit to being able to serve someone in the location where they're having a crisis. I think that the challenge for me, I agree with the data problems. I think they need to fix that or at least become more transparent about it. But I think that the challenge for me is that if there's not infrastructure and support to help someone in crisis, this gives more fodder for police or other emergency services that may not have the mental health training to support a mental health patient or a caller in crisis. And so I think that over time, this probably makes sense, but there's so many other fixes that need to happen that I share your worries about data. I share your worries about, you know, police, but I think that in time, wouldn't it be great if a mental health crisis team could find somebody and support them so they didn't complete suicide? I mean, I think that would be great. I think that's the motivation behind it. But if we're just supporting more police work. I don't think that's what this was for, and I don't think that's how it's going to help people.
While super bills can be helpful for your private pay clients, they don't help clients access therapy today. When clients see you weekly or biweekly, they may be out hundreds of dollars before they receive reimbursements 4 to 6 weeks later, which can be financially straining on them. Thriser's mission is to help clients access therapy today by working to get them instantly reimbursed for out-of-network sessions.
First, you can help your prospects instantly verify their out-of-network benefits with Thriser, providing them complete transparency on the cost of therapy ahead of their first session. Then, just by charging your clients via Thriser's payment platform, you can offer them courtesy claim submission and end-to-end claim management, and even let your clients just pay a coinsurance for sessions, similar to in-network copays, to skip the reimbursement wait entirely. How? Thriser covers the rest of your fees so you get paid in full up front, and they wait for a reimbursement on your client's behalf.
Thriser also has a super bill uploads feature, which is completely free for therapists. If you'd like to instead offer your clients a resource to manage their own super bills, Thriser manages all claims end to end, so you and your clients don't need to deal with any of the insurance stress. Visit join.thriser.com/modern therapist and use our promo code Modern Therapists to start your free trial and receive waived fees for your first $2,500 in payments.
I think the other thing that I'm not clear on, and this could be a, quote unquote branding or messaging issue. Do they have the ability to manage someone who's calling 988 because of an emotional crisis where they're not contemplating suicide? Because we've talked about some of the reports that we've heard back around how these workers are actually managing these calls. It's not a mental health, let me get a quick coaching call kind of situation. It's I am contemplating suicide and I need crisis response. At least that's how I'm understanding it based on what we've read. What is your experience? Because I know you've dug a little bit more deeply with your, kind of interest in suicide and suicide prevention. What is your understanding of the training and the abilities, the capabilities of these workers?
So what I'm finding in my research is that the requirements that people who staff these call center lines varies from place to place. The one that I was able to find the most familiarity with is the one that is located close to me, which is run by Dee Hirsch, which is a behavioral health center here in the Los Angeles area that does a lot of DMH type work and
Sure.
Respectable place kind of overall. Their requirements for a call center worker are that it must be someone who is at least 18 years of age,
Okay.
that they go through about 60 hours of training, and that they have reliable computer phone systems at home. People take these calls from home kind of things. With a strong preference for people who have had a direct experience with suicide, either loss of a loved one or something like that. So the requirements are not to be mental health professionals. And they even explicitly state on their website that they don't provide supervision for people earning hours towards like our board licensure sorts of things. These are volunteers in the truest sense of the word, and people who go through about 60 hours of training. Now,
And on the national website, they said that typically, like, the average is 90 hours of training. So it's interesting. So the closest one to us is only 60, and that's being advertised. So it's a broad array, I'm assuming, of how many hours of training and what that looks like. And some are volunteers, some are paid, right? Like there are some paid hotline workers, so we don't know that.
I think that there has to be staff who are kind of overseeing volunteers at some of these places, and this is just kind of where I think it varies so much from place to place that it's hard to say that there's blanket policies
Sure.
and procedures in place. And I think that, and that's even stated in the Mad in America article, is that there are plenty of differences from one place to the next, that there's some loosely unifying things across the more than 200 call centers across the US, but nothing that's here are the specific standards and protocols in every single place. The responses that people are getting from call center staff are varied across what their experiences are. Some people have reported, and there's some journal articles that we'll put in our references here, but some of these are also some of the experiences that clients have told me. And some of the experiences that people have are these are some of the most comparing, compassionate calls at the times that I needed. At other times, there have been from some of these research articles reports that staff are rude or dismissive, that some staff will end up spending a lot of time talking about what suicidality is and then say, we have a time limit that is available for each call and we have run out of time, not giving the person who's calling in much time to actually talk about things. One report looked at a sampling of about 230 transcripts and found that in 4 cases, the volunteer call worker encouraged the person to go ahead and complete the suicide.
Wow. Yeah, I mean, we were really concerned about the volunteer structure that volunteers there's, if you're trying to get somebody to volunteer to do something like this, like there's less folks who have the ability to do it. I think there's also training, when you're forcing a volunteer to be trained, sometimes the engagement is lower, sometimes the capacity is lower. If they're not providing supervision to pre-licensees, suspecting they're also not providing a lot of supervision to these volunteers. And so the ability for compassion, the ability, and compassion fatigue, I think there's just so many problems with this that I really get concerned. I mean, I don't know if it was the SAMHSA website or the Vibrant Health or the 988 website, but there were like some testimonials like that, you saved my life literally, and that kind of stuff. So I'm sure that there are some really great hotlines and hotline workers, but to have even, I mean, I don't know what percent of that is, 4 out of 280. That's not a huge percentage, but it's not low and it's not acceptable. But to have them suggesting, why don't you just complete suicide? Like that is ridiculous. That is so far out of best practice that I'm just very concerned because it doesn't seem like there's enough infrastructure and the ability to actually create some solid work here. I mean, I think if they're going to use the 911 electronic system, they probably should also use the 911 training system. But I don't know, we've not looked into 911. Maybe they go rogue too. But this is so cobbled together.
So a couple of other things I found on the subreddit r/mental health, a post said, I called the 988 hotline. So this post says, I called the 988 hotline. They hung up twice. I finally talked to a lady and she was really condescending. I tried telling her how they hung up on me and she said, well, that's not me. I didn't hang up. So why are you complaining to me? So I just let it go. I tried to talk out what was going on with me. And she said, I'm a 37-year-old black woman. You're a 22-year-old white girl. Don't you think I have it hard? Do you think it makes us feel good to listen to you complain? It could be worse.
Wow. Okay.
One of my clients, and I have permission to share this, reported that she had called 988 at a point, and after about 40 minutes of very unsuccessful help in a moment where she was contemplating ending her life, that she ended up not only hanging up on the call, but there was no follow up to her. And she stated that her reason for living after such a terrible experience was merely to survive long enough to tell me just how ridiculous the whole system was.
Clearly a client of yours.
Right.
I survived to tell Curt so he could complain on the podcast about it. I'm assuming that you did appropriate, emergency response and crisis planning after that. But it
Yes,
is kind of funny that your client would say, I survived in order to tell you about this.
exactly.
Um, I think it's so hard because I understand that crisis response can be really hard.
Yes.
And especially if you're not getting paid, or if you're getting paid very little, you're poorly trained, you don't have supervision, I could understand how it'd be very challenging to keep yourself out of it, to not say like, "Hey, stop complaining, you don't have it as hard as I do." Or to not be able to do the interventions that truly, it sounds like, are more along the lines of therapy or crisis coaching versus a hotline worker just providing resources. And so it feels like there's some sort of improvement or revamping of how this is working. I know I looked back at our episode from a couple years ago, and your idea was like, like, use this for helping the mental health workforce, like give people double hours, pay them well, and have these folks just out of grad school staffing these hotlines. That would be awesome, right? But it costs money and it costs time, and that's one of the other things that we reported, and we're getting close to the time, so I think this is where we're gonna have to finish up, but that was one of the things that we worried about, is that there was a lack of ongoing funding to develop these resources. There's some folks that have put in place, kind of charging for calls. Some people are trying to see if there's some Medicaid or other things, but they're gonna have a hard time not being HIPAA compliant if they're actually taking Medicaid dollars. But they're trying to cobble together this resource, this funding for this resource that is literally about saving people's lives, and there's not a federal element to it that goes beyond, I think it was a few years. And so, to me, we've got this system. I guess the question I have for you, Curt, is do you feel like this is better than nothing?
98% success is 98% success. I
Okay,
don't want
let's
us
give that to them.
I don't want to minimize that most cases seem to be resolved without in-person intervention needed, whether that be crisis team, whether that be law enforcement that's sent out. It seems to be working 98% of the time. It's just that the 2% of the time seems to be something where those are not going any better than they have in the past. According to SAMHSA and VEH, that the 2% has been consistent with the number of in-person interventions since the 10-digit hotline was out before the 988 system. And so there's more calls coming in. So 2% is going to mean
More
more
people.
more people, and 2% is going to mean more interventions just on raw numbers.
Sure.
The intervention concerns, it is better than nothing, and I don't want to focus on, in their statistics, my client who chose survival just to tell me how terrible it was probably gets marked as a 98%, like that was a successful call on their end. I don't know that 98% is exactly 98%. To answer your question simply, yes, it is better than nothing, but I don't think that that means that we have to stop aiming to improve it. Now, the concerns brought up in the Mad in America article about data and that kind of stuff is alarming in ways that I don't think that most people are going to grasp. It goes against our ideas around like informed consent as far as what is happening with this information. It's another byproduct of businesses managing mental health and mental health care that is run by these businesses run by business people rather than healthcare people.
Yeah.
So I do have a lot of concerns as far as what happens with this data, what happens when it gets sent out to the Facebooks and the Googles and the Amazons. And I don't know that that is necessarily something that most people are going to realize until some years down the road. It is seemingly really good to keep people out of the emergency rooms, which we've had suicide episodes around, that could potentially be worse. It does seem to be working in a lot of ways. There's still a lot of room for improvement.
And it sounds like there may be some room for advocacy from mental health providers, that this is, if you have the capacity and an interest and some knowledge, being able to talk to legislators about some reforms that need to happen. Maybe that's another episode where we can talk about that. But to me, I feel like as a mental health provider, my goal will be to have resources in place so my clients don't feel the need to call 988.
Mhm.
But it sounds like 988 is a good last resort. I hope that in building it out and having improvements that we do get a stronger workforce that are staffing these hotline numbers. I think it would be really good to have that. I think I think for the 988 data, all of the data that potentially is being used for research or those types of things, I think whether it's an increase in transparency or actually coming through and trying to kind of adjudicate, are they breaking the law here? Are they skirting the law? Are they doing something that is not appropriate? And then have that fixed, I guess. I'm not able to say it well, but I feel like the data thing to me is worrisome and may hurt people. But my bigger concern right now that feels a little bit more fixable within the system versus, kind of a let's take this all down, is making sure that when people call in, they actually get the help that they're seeking.
You can find our show notes over at mtsgpodcast.com. Follow us on our social media. Join our Facebook group, the Modern Therapist Group, to continue on this conversation. And until next time, I'm Curt with Katie Renoy.
A final thanks again to our partner Therapy Notes, the highest rated practice management solution for behavioral health. Don't forget that you can use promo code MODERN for 2 free months when you sign up.
Super bills and reimbursement waits are not a reliable solution for out-of-network clients. With just a click of the button, you can offer courtesy claim submission and end-to-end claim management support, and even allow them to skip the reimbursement wait altogether with Thrizer. Visit join.thrizer.com/modern therapist and use our code Modern Therapist to start your free trial today.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.